is Vicki Shabo. Vicki Shabo is the Vice President of the National Partnership for Women's and Families after serving for more than 4 years as the organization's Director of Work and Family Programs. Ms. Shabo is responsible for the strategic direction of the National Partnership's work to promote fair and family-friendly workplaces. She leads the organization's work on paid sick days, paid family and medical leave, expansion and enforcement of the family and medical leave, workplace flexibility, fair pay, and pregnancy discrimination. Thank you very much for being with us.
Thank you so much, Congressman Cummings and members of the committee. It's great to be here today, and I understand your time pressures. The National Partnership is working to make our country more healthy, fair, and family-friendly. Our key priorities address the workplace policies you mentioned, reproductive rights, and quality, affordable health care, all in service of promoting the gender and economic equality we need and the robust, inclusive economy that will benefit us all. We'll follow up with specific language on all of our priorities, including defense of the ACA, non-discrimination in healthcare, payment and delivery system reform, ensuring that we eliminate barriers to contraceptive and abortion care that's so vital to women's financial stability, workforce attachment, and educational opportunities. But I'll focus my short time here today on our top workplace policy priorities. First, I want to address Americans' need for paid family and medical leave, an issue that has gained incredible traction over the last year or two, and some before that, among political and business leaders, state legislators, the press, and the public. We believe that every worker in America should have access to paid family and medical leave, no matter where they live, who they work for, or what job they hold. We can do this through an affordable nationwide program. Prior platforms have referenced partnering with states to provide paid leave, but the 2016 platform must take the next step and call for a national paid leave program that assures all working women and men at least 12 weeks of paid leave with at least 2/3 wage replacement to care for a new child, a seriously ill loved one, their own serious health conditions, or for certain military caregiving purposes. The Obama administration, Secretary Clinton, Senator Sanders, and party leaders in Congress all agree with this national approach and key principles. 87% of workers today don't have paid family leave through their employers, and 60% don't have personal medical leave for serious health issues. For low-wage workers, the situation is much worse, and the inequality that we have manifests not only in circumstances today, but also in children's opportunities and family economic security for the future. The evidence that we have from the states is great, and it tells us a lot that these programs work and about program design, but a state-by-state approach is never going to result in nationwide coverage. The administrative infrastructure challenges are too great, as are the inefficiencies, and the political realities are too stark. The voting public across party lines overwhelmingly agrees with it that it's time for national level change. 76% of likely 2016 voters favor a law that would create a national paid leave program like I've described, and 61% of voters strongly favor this proposal. Voters also believe by a 7-to-1 ratio that lawmakers and candidates that support a program like this understand their needs and the needs of their families. Paid leave benefits workers, families, businesses, and taxpayers. It boosts the economy, and there's powerful evidence that businesses are not negatively impacted and in fact are helped when we address this through public policies. I'll just quickly also put in a plug that the platform reiterate its support for paid sick days, which is the proposal in Congress that allows workers to earn 7 days of paid sick time. 44 million workers in this country still don't have access to a single paid sick day, despite the tremendous progress that we've seen over the last 2 years in the development of these laws. I'll also just second what Melanie Campbell said about equal pay and ask that the Paycheck Fairness Act, robust enforcement of existing anti-discrimination laws, and some new policies that would increase salary transparency, require comparable pay for similar work, and eliminate prior salary matching also be in the platform, as well as protections for pregnant workers so that they're not forced out of their job when they need a reasonable accommodation. So I will stop there and welcome your questions.
Thank you. Any questions? Thank you very much. Thank you.